Thank you, Zach. Food Allergy Awareness Week this week, and joining us this morning is Dr. Thomas Smith. He's got some really good information for you, for parents who maybe have kids who are suffering from food allergies, and some good news in terms of the progress they're making as far as maybe finding a cure to food allergies, or at least lessening the symptoms and the effects of food allergies. First of all, it's good to see you. Thanks so much.
Thank you.
So when we talk about food allergies in kids, what are the most common food allergies that you see in your practice?
In children, there's 6: egg, milk, pea, peanut, soy, and wheat. Milk more common in younger children. Egg certainly occurs not uncommonly. The others less often. Small children can become allergic to shellfish and tree nuts also, but peanut and egg are probably the most common.
Okay, what are some risk factors? Are there any?
If you are food allergic, you can have relatively minor symptoms, vomiting, which certainly will fix the allergy, hives, wheezing, runny nose, up to severe reactions called anaphylaxis, low blood pressure, difficulty breathing, very serious symptoms.
Sure, and sometimes they can be fatal.
And they can be fatal, absolutely.
Now, in terms of risk factors of your child developing a food allergy, do we know that? Why are these kids developing the food allergies?
It's not known. People have tried interventions like not feeding children certain foods early, delaying introducing foods into their diet, and that seems to be not helpful.
It doesn't matter.
There is some interesting data that says that early introduction of certain foods heads off becoming allergic. But that information is ongoing. It may be better to feed the food early than to delay it.
Well, sometimes, like with pregnancy, they'll say, well, don't eat peanuts if you don't want your child to have an allergy. You know, there's some kind of thought there, but there's no data that shows that.
No data for that.
Okay, there's really no indication whether your child's going to have a food allergy or not.
Right.
And unfortunately, like in my case, we found out just by chance. I mean, my son was 2 years old. We gave him a cashew, and all of a sudden we're at the ER because he's allergic to tree nuts. Is there any way to thwart that for a parent to find out in that kind of case?
There's not, actually. One might try skin testing large populations, but the incidence of positive skin tests is going to be low. And there's also a phenomenon where you have a positive skin test but can eat the food, a clinically asymptomatic hypersensitivity. It's much better to, well, the only real choice is to wait and know that it's unlikely your child will become allergic and wait and see what happens.
And then as you go forward, obviously you're working with the schools and you got to have the epi-pens at the school. How important is that?
Yeah, that's essential. The information says that you save lives by early use of epinephrine. So it's very important for schools to have epinephrine readily available, not locked in some nurse's drawer.
Right.
And you need 2 of the injectors because there's something called a late phase response. No longer can you keep one at home and send one to school. They need to travel in pairs.
Okay. And what is the late effect? How does that work?
Yeah, you get benefit from the first dose.
Okay.
And as the dose wears off, the food is still around. You get a second wave of symptoms. Perhaps before you get to an emergency facility.
So it's important if you do have a child with food allergies to have 2 at school and 2 at home.
Correct.
Right? And maybe carry one with you just in case something, carry 2 with you just in case. Real quickly, you said that there's some new data in terms of responding to these food allergies and maybe curing it someday?
Well,
I mean, is that what they're saying?
There's hope on the horizon. There's an injectable medicine that binds up allergic antibodies that works quite well in asthma. That's being studied for children with food allergies. It's not approved yet, but those studies are underway. There are also strategies for desensitizing children to foods, also under study, not approved just now, but that looks hopeful.
Very interesting. Well, thank you so much. We appreciate it. It's good
to see you.
Thank you
very much.